welcome Marjorie to the summit. So Marjorie is a massage therapist and travels the world teaching other health professionals the value of assessing and treating scar tissue. Today we're going to be talking about the feeling of iron bra, listening to or seeing what people are writing on Facebook, and iron bra just comes up again and again and again. And so it seems like, when those people aren't getting the help that they need to reduce the symptoms. So today what we'll do is let's just kind of unpack this iron bra, because it's hard for many people to understand what it is. So welcome, Marjorie Brooke. Let's start with what it could be, Marjorie.
Well, what they're referring to with iron bra is the restriction in the rib cage and some of it into the back or even into the abdomen, but mostly they call it because of when you have a mastectomy, all of the scar tissue, even if they've done reconstruction, it actually compresses and limits the ability for your rib cage to expand and contract like with normal breathing. And it literally feels like worse than, but for some women who've never had experienced this, picture wearing a workout bra and then having to run errands and not having a chance to change, and then that bra drying while you're wearing it. It's extraordinarily uncomfortable, extraordinarily restrictive. Now multiply that by like 50. But the problem is with the iron bra feeling that after a while, women just get used to it. It becomes their norm. So they just, they live with it and they don't, overly realize it after a while. I've had clients who've stopped doing yoga, stopped working out. They can't breathe properly. They feel the pull. It's bad enough that they have improper range of motion, but that constant restriction it really is life altering. Even when it becomes your norm, it's always there unconsciously, and it's limiting you on many factors. It's it's restricting circulation. It's limiting range of motion. It's limiting your ability to take a full inhalation and exhalation, and it's really just horrible.
And so people would mostly say, I've got an iron bra feeling. They wouldn't say, I've got scar tissue.
Correct. They wouldn't say they have scar tissue. They also, most of the time, won't even realize that they're not taking a full breath. Most people do not fully inhalate and exhalate through life, and they, the muscles in between the rib cage, the intercostal muscles get tighter and tighter, and limit the ability to breathe. Also, what they also won't mention is probably that their neck muscles are tired, because many women with the iron bra, instead of their rib cage expanding and contracting, they're breathing through their collarbones, which is lifting the rib cage to lift the diaphragm instead of opening. So they end up with extra tight scalenes and muscles, SCMs in the front, and it's part of that pull down after a while. It's bad enough the restriction and the pull from the mastectomies and from some of the reconstructions, but then you add in the fact the only way they can breathe is by lifting the rib cage through the muscles in the neck. They won't realize that their neck issues and their shoulder issues are coming from that. And that fact, the main thing that they don't really realize that they're not totally breathing correctly unless they're trying to do something like yoga.
And Marjorie, not everybody gets this iron bra feeling. Yeah. But when someone does have it and you observe their chest, what do you see?
Well, I see that the rib cage is not expanding. I see that it's pulling up, they're using up to their neck, and I see very limited range of motion. I see that the diaphragm connected underneath the rib cage is also not fully moving and getting restricted, especially depending if they've had a reconstruction, say a deep procedure, where they've come up through the abdomen, and many of the deep procedures also then give a tummy tuck, which then gives a pull coming in the opposite direction of where they're trying to lift the rib cage and expand, and now they've got the pull down from the tummy tuck. So I just see immobilization on all fields.
And
the one other big thing too is a lot of women will tell you that they're numb, that they have no sensation, they can't feel. That they just don't feel their rib cage, they don't feel their chest, everything is numb to them. And on top of that, you can add the fact that women then at that point as it is, they have the emotional issues of not wanting to look at or touch themselves. Now, even if they touch themselves, it feels even more alien because they can't feel. There's no, the nerve endings are wrapped up in the scar tissue. The proprioceptors, all the receptors are wrapped up in that scar tissue, and there's just no sensation.
And so, Marjorie, just to be very specific, when you're talking about scar tissue, it's not, let's just say if it's a mastectomy, it's not just a mastectomy line. It's the skin and the tissues underneath and the tissues underneath that.
Well, it's the layers. It's not just where you see your scars. It actually can spread throughout. Plus, remember, you're wearing your compression bandages. If you've had other procedures to redo reconstruction where they've taken from the scar tissue from that, scar tissue is like monkey mind. Scar tissue will meet scar tissue. It'll find due to the torsion and the pull in the body. So you can have scar tissue on your chest and a scar tissue on your stomach, and eventually where you move, they're going to find each other and around from the back, and it's all going to kind of restrict and pull together. So it's not just about where the incisions were, where the surgery were, and you can add into that, it's not just the muscles around the rib cage are also being restricted from all of the tightness of the scar tissue and from when you were wearing the compression bandages and everything else. So they've actually tightened and atrophied and shortened. When you don't use them all the time, they start to get tighter and tighter, making it harder. So that's also part of the therapy where you have to open up in between every single rib cage. Every single rib, not every.
Some people will know that their wound heals slow. And so they might have had a seroma or they might have had an infection. Is this something that can add to the scar tissue?
Definitely. The longer a wound is open, the longer it takes to heal, the more you're going to have scar tissue. So if you have had an infection or have to go back in multiple times, say there was issues with the first reconstruction, or you put implants in and the body rejected the implants, or and you just started having infections, it will create more scar tissue, more restriction. The larger the wound and the longer it takes to heal, the more and more scar tissue you're going to have.
People think that when they've been in hospital, they've been given the exercises, which is usually arm stretches, that I guess they believe that that's what is going to solve the scar tissue.
Well, I can't speak for what they believe. I can say, no, that's not going to solve the scar tissue. Actually, it may help with the range of motion, but it's still going to be limited. You need to release the tissue, get it moving the way it was designed to. Also, when you have restriction with scar tissue, you have a lot of nerve endings caught up. And on top of it, if you've had radiation, this tissue is already lesser than what a normal tissue would be. The effect of the radiation is causing less function and more pain. So you really need to release the tissue and restore as much of the functionality of the tissue. And we're not just talking on the surface, your skin, we're talking all the layers all the way down to your rib cage and beyond need to be released and get it moving again from being stuck. And then we would incorporate all of the range of motion exercises, and not just your arms. Your neck would be involved, your rib cage would be involved as far as breathing exercises and rotation and flexion and motion. So it's never just your arms with a mastectomy. It's really your entire trunk and any other body part that may have been used. If you've had a reconstruction where they took a piece of your lats or a piece of your glutes, and all of those areas also need to have scar tissue release, and they need to be rehabbed. Your whole body needs to be reintegrated. That is something that is very much lacking. They don't really give the rehab that's necessary to begin with, and they explain to the patient that it's not a big deal to take a piece of your lat. It's not a big deal to do the deep procedure and go up your stomach, and not a big deal to take a piece of your glute. But it is. Those are functioning muscles that are now missing a piece, and those areas have to be released and rehabbed.
Marjorie, I'm going to take you up on the word release. We are so used to a computer where we can just press a button and reset. Is release and reset the same thing?
No. Release means you have your tissues, which are stuck. Your tissues should be sliding and moving. And once you have scar tissue and or adhesions, the tissue doesn't move. We need to release that tissue. In other words, get it moving again. And once you have scar tissue and or adhesions, the tissue doesn't move. We need to release that tissue. In other words, get it moving again. We need to release that tissue. Okay, that's step one. Get everything moving. Reset or rehab. Reset would be closer with the word rehab. In other words, we have to re-show your body, relearn your body how it's supposed to move. It's called neuromuscular re-education. We're trying to retrain your body and out of the compensation that it's been in and out of the damage that's been caused. If we're missing muscle, we have to retrain the body how to cope and how to function with that piece of muscle missing that might have been used for the reconstruction.
Mm.
Or even just not even muscle. Let's say you did a tug procedure, where a tug flap, where they took everything from your thighs and then they tightened up and did almost like a tummy tuck around the thighs. Well, now we have limited range of motion in the hips and in the legs that has to be restored, and we need to release the tissue, because many times with that type of procedure, women feel a vaginal pull from the scar tissue, and the doctors don't do anything about that. They just either say it's in your head or that there's nothing they can do about that, but there is, just by releasing the scar tissue that's wrapped around the thighs.
But if someone has an iron bra feeling, let's just say after 6 weeks or 8 weeks after their surgery, can you give us like a ballpark figure about how many treatments that they might need for the release?
Honestly, no, because as you mentioned, some people have infections, some people heal slower than other people. Within the first like 6 or 8 weeks, right in there, if from the very beginning, they should be getting lymphatic massage, myofascial release, and very gentle range of motion. That in and of itself is going to keep the iron bra feeling from setting in. After about 8 to 10 weeks, if you've got that iron bra, and the person is healing well, all right, and their procedures are over, because again, we're talking with someone when was their last radiation treatment and how that was going. Then we can start working. And for some people, depending on how the surgery went, was it a single mastectomy, a double mastectomy? What type of procedure did they have for reconstruction, if they did reconstruction at all? All of those come into it. So, but I will say that right away, as soon as you start doing the work, you will feel a release. You will feel better. We will get you breathing.
And so, Marjorie, I do want to honor those people that have iron bra feeling forever, because some damage is damage.
I don't think there's damage, but I don't think they'd have the iron bra forever. That's a misconception. I just had someone who came in who had a tummy tuck off a deep procedure, and she told people that they're with the abdominoplasty that they're never going to feel their their abdomen again, and that's not true. Your fascia is malleable. The connective tissue is very malleable, and you can always release it. As far as your range of motion and your ability to move, well, that all depends on if you've had it for 10, 15, 20 years, how has your body altered itself? How has your bones shifted or changed because of this pull from the iron bra? We can always release it and get rid of the tightness and the restriction, and then restore as much movement and range of motion as your body's capable of doing. I've worked on scars as old as 80 years old and made a difference. There's never, that's it, I'm going to be this way forever. There's always hope that we can be able to bring you back to as better function as possible, and definitely feeling again, having that sensation, feeling your skin, being able to feel your clothes on your body. Or on the opposite, for those who become hypersensitive, that wearing clothes is irritating to them, this is something tight, that can also be released and stop that as well.
You're going to include the video so that people can see what we're talking about?
Yes, the little clip that I included, I was doing a demonstration at a class from a woman who had a double mastectomy. She had reconstruction, but it failed. She ended up getting infected and rejecting everything that they did. She ended up with multiple surgeries in her stomach, and including surgery within the last year. She had the breast cancer, I believe, 5 years ago. Or no, excuse me, no, 20 years ago. It was 20 years ago that she went through all of this. They overdosed her on the radiation back then. They burnt her through the front and the back. And basically she volunteered for the class. I was demonstrating for some of the students. That's who you'll hear in the background. And as I'm working on her, you're going to see her getting sensation back. And I believe the clip includes some of a referral for her rib cage. We did a couple of different clips where you can actually see me start to work with her and get her to start using her rib cage and retraining her how to breathe and releasing the scar tissue so that her rib cage would once again function normally.
Thank you very much for sharing that, because many people do not really understand iron bra, and that's because they don't see it. When people are listening to this now and they think that this might be something that they could investigate, how do they find a therapist that has these skills?
They can contact me at marjoriebrooksseminars.com. I have some listed there. They can just email me, Marjorie at marjoriebrooksseminars.com. And I can try to find someone in their area. If there isn't someone who's trained specifically in the scar release, there are other modalities that can still help, if not directly with the scars, but indirectly with the scars. Myofascial release, visceral manipulation, some people who do cupping, and those who do acupuncture. There's multiple modalities. In fact, my work includes almost all of the modalities that I just mentioned. That's why it's called the straight method, scar tissue release and integrated therapies method, because I don't believe that there's one end all be all. It's a combination, and we have to find the right combination for that patient and for that person for what's going on with them. So if they contact me and give me drop me an email or a message, I will try to find someone, if I know of, in their area. If not through me, through the wonderful website. What, Denise, say it again?
Yes, foundation96.com.
Where therapists are listed throughout the world on that wonderful resource sharing website.
Thank you very much, Marjorie, for your amazing discussion on iron bra, and I hope that it offers some hope for people that are listening today.
Same here. Thank you for putting together this wonderful summit once again.